Hello, everyone. I'm Sheldon Barlett Rumor, and this is it. Welcome back to This Is It TV. It is always a pleasure, and I always learn more the more I talk to our next guest. I want for him to reintroduce himself to all of you, his first and last name, and all he's up to.
Sheldon, I'm Louis Bezich, men's health advocate, contributing writer to phillyvoice.com, and of course, the author of Crack the Code 10 Proven Secrets That Motivate Healthy Behavior and Inspire Fulfillment in Men Over 50. How are you?
I'm good. I'm good. I'm good. I'm good. And again, you never disappoint. I'm excited about what we're talking about today. What are we diving into this morning?
Well, we're going to dive back into a topic we've talked a lot about. But if you hadn't noticed, there was an election the last few weeks.
Correct.
And one of the things I'm going to leave the analysis, the political analysis to others, but because
Sure.
our focus is on health here. But one of the factors that really emerged was a strong surge of hyper masculinity. It was
Hypermasculine.
embedded in one of the campaigns and came on very strong.
For sure.
And the question becomes, because that influences culture and ultimately behavior, where are we going with masculinity in this country, and how do men feel about it? We saw some, recently you and I spoke about some inklings of movement where, particularly with mental health,
Yeah.
there's a growing acceptance, particularly among younger men, that it's okay to acknowledge depression and other mental health needs. But at the same time, before the election, we saw some results, some survey results coming from the Pew Center for Research, indicating that masculinity in its traditional forms is anchored. It remains anchored in the male psyche.
Yeah.
85% of the men that they surveyed showed either a leaning towards a masculine characterization or feeling very masculine. And so it seems like we're still there. And the concern I have, of course, is that
Yeah.
part of that traditional view of masculinity is that I don't need to see the doctor. I don't need to get any tests or screenings. If the pain gets, harsh enough, I'll go in there. But otherwise, I'm good.
Yeah, this idea of toughing through it. But what we find, or based on the discussions that you and I've had and just general knowledge, is
Yeah.
that toughing through it, sometimes you're waiting so long, right? And then something that could have been addressed early, something that could have really been tackled with modern medicine, with a number of different factors, really gets into a really bad situation because you were trying to man your way or man up through it. And I think that really be allowing for there to be some softness to a conversation without taking away from who men are, but
Right.
really allowing that to be part of being a man, is to allow yourself to be vulnerable at times or to allow yourself to ask for help.
Yeah, it's always ironic. We talk about the classic example where men pay more attention to the condition of their cars, or the professional athletes and all the medical care that they get. But when it comes to them, there's this just misperception that somehow seeing a physician for an annual visit or getting a screening or something is a sign of weakness. It is not. In fact, what we see and what you and I have talked about before, actually coming out of the NFL on the mental health side, is that acknowledging a problem and seeking care is a sign of strength.
Strength.
And not to mention, Sheldon, as men, we see ourselves as guardians and protectors of the people that we love, our children, our spouse, important people in our lives. Well, you can't take care of them. You can't be a guardian if you're not physically up to it.
You can.
Or unfortunately, if you're not even around to
Right.
fulfill that role.
Right, right. I think that men's health really, if anything, can support the masculine nature, right? So, I mean, all of the things that go along with this, patriarchal or masculine space, none of that can be you being a provider, you being able to, protect your family. All of those things cannot happen if you yourself are not well. So I think it's one of those contradictories, right? Really battling up against itself to say, I'm not going to take care of myself because I'm so masculine. Meanwhile, it should be at the forefront of masculinity is to take care of it.
Exactly. So that gets into, changing cultural views and norms out there. And I do think that in an ironic sort of way that maybe one of the things that can come out of the election is, once and for all, the establishment of a federal office of men's health.
Yeah.
Back in 1991, the federal government set up a office of women's health, and we can see that it's done great things to you can see the outcomes. Women obviously live longer than men, have less chronic disease than men, and generally, take care of themselves more. And that's been great. Efforts over the years to get Federal Office of Men's Health have fallen flat on their face and not going anywhere. So in an ironic sort of way, I think, if we can do that, that maybe that's one way we can
Sure.
redefine masculinity and say, look, strength is good. A level of assertiveness may not be a bad thing. Just being, dedicated to your family and such are all good things. But within that definition can be, and it's okay to take care of yourself.
Yeah.
It's okay to maybe, just pay a little bit of attention to your diet and maybe, be active just a little bit, because that all gets you to that ability to protect and provide for those
Yeah.
that you love.
For sure. And maybe it's something, based on the fact that we don't have the federal support, based on the fact that there's very few organizations, right? You see, and being part of This Is It Network, you see us constantly on our women's health mission, right? We're having events, we're having wellness days, we're having all of these different things to be able to support. And we're so grateful for you to really join us in the movement and really talk about men's role in all of that and our, the importance of it being a family affair. So we're so grateful for you for that. But
Sure.
if we were able to increase the amount of activity, increase the amount of educational opportunities, increase the amount of effort that is being made to help and support men's health with an initiative of sorts, right? Not just assuming, we'll get around to it, they'll get around to it, we'll mention it a couple times, but a really concentrated effort to really bring, we've talked about so many things that, but there's, prostate cancer. There's so many larger issues that are really affecting men that a concentrated effort, I think, is necessary for sure.
Yeah, no, I think the time has come. And again, let's take those views on masculinity and kind of flip it on their head and
Sure.
see if we can't make the most of the passion. Because look, there's clearly passion out there. There's clearly folks that are looking at this and have been activated as a result of it. So let's try to channel that energy in this in a very positive direction.
I'm all for it. I am all for it, my friend. And I know you're already doing the work. And
Oh
I
yeah.
know you have the information out there. People can find you. And I want to make sure that those that are listening and watching in this moment can do the same. Where can people find you, my friend?
They can certainly get me on social media at Louis Bezich and go to my website, louisbezich.com, and you can see what's going on in my world of healthy behavior and all that I'm doing.
I love it. I love it. You have no choice. I mean, if you really want some clear perspective to help you live a better life, you need to follow, fan, and like my dear friend. So, so good from all of us here at This Is It TV. I'm Sheldon Barlett Rumor, and we will see you soon. Take care.